are continuing our webinars, Raysearch webinars. So it's day 2, and we just started. We had a lovely session to begin with about clinical data in radiotherapy department. But we are not stopping there. We have plenty more planned for today. And the next session is the one to celebrate, of course. So we do have a lot to celebrate today. So today is the second day of ESTRO 2025. That's a good enough reason. It's also not as hot outside as it was yesterday. Another reason to celebrate. And we're probably not going to have a very scary thunderstorm. So here you go, 3 reasons to celebrate. But for the next half an hour, let's focus on one, and that's experience that comes from Royal Marsden in the UK, and it is about adaptive workflows. So they managed to do something magnificent, and they will tell us more. And we were with them on this journey together all the way. And for we are Raysearch, and for today we have one of our researchers representing us. And that is Anna Lundin. Hello, Anna. So Anna is our technical product manager. So she will be one of our presenters today. And the next presenter is Alex Nava. Hello, Alex. So he is a radiotherapy physicist at the Royal Marsden Hospital. And I hope you're ready. I know that these guys prepare some extremely interesting information for all of you to feed your curious mind. So let's take it away, Anna.
Thank you. So why are we all here? We want to give the best treatments achievable to each patient. And when we talk on adaptive, the way we want to reach that is by systematically monitoring the course of treatment and the treatment response, and then update the plan for each patient individual in an aim to improve the disease control, meanwhile we reduce the toxicity to healthy organs. Over the years, it has been apparent that there are different timescales of adaptive. So to be able to talk on the requirements that put, we have started to divide it into offline adaptive for the adaptations that we do in between fractions. We call online adaptive for the adaptations that we do when the patient is on the treatment couch, and real-time adaptive for the during session adaptations with tracking or target or gating. But in reality, there is a constant ongoing change to what we want to treat. Some things have changed in seconds, others in minutes, hours or even weeks. And the selection of adaptive strategy that we want to take needs to be very wisely taken. We shall not treat online adaptive just because we're capable of doing it, and we shall neither just keep to rare offline replannings because it takes a lot of resources. So for each situation, we need to look at the change that we're actually trying to compensate and their time scale, and then we need to do a wise decision on which is the best adaptive strategy to use. And that decision shall be based on your clinical knowledge of the care of the patient rather than on hardware ability or our available resources. If we look at the core content of the adaptive feedback loop, the timing and speed of the process is very different if we go for rare offline replannings or if we go for online adaptive. But the feedback loop in itself, it always stays the same. And this has been a very important aspect for us when we have designed the Raysearch strategy for adaptive. It influences the full core of what we do. So we want to build a framework for all adaptations that allow you to freely choose the adaptation needs that you have, that is beneficial for the patients that you happen to have at your clinic. So we want a system that supports the full adaptive continuum from offline replannings to online replannings. And we want a system that supports the same efficient workflow, independent on if it's an offline replan or if it's an online replan. And that is independent of which treatment machine you happen to have available at each moment in time. So, what have we done? So, last year we released the first version of this more efficient workflow for adaptive. It's intended for all type of adaptive, independent of which treatment machine you have. It's automated. It's possible to tailor for each indication. And it includes dedicated review work steps for all of the different steps. But we are just in the beginning of the journey that we have started. Our vision is that we can bring a fully practical adaptive solution to the full radiotherapy department. As we will hear from Alex, it is possible to use Raystation as the sole provider of online adaptive, where we can count on the fast replanning abilities to reach what we need. And with the new Raystation release version 2025 that we show here, please come and see it. We have improved that, and we continue to work on a fast and improved adaptive workflow. But if we also bring RayCare to the workflow, we can now work towards streamlining everything from data transfer to progress reporting. And our vision is to use that to enable online adaptive on any treatment unit. So we are committed to work with Royal Marsden and other clinics to ensure that we get an efficient adaptive workflow at your departments. And we have done the first proof of concept tests using RayCare and Raystation on just a normal Linac to reach an online adaptive workflow, and that looks very, very promising. So I'm very impressed and I'm very inspired by the work that Alex has done, and with the first version of what we had provided. And I'm very excited to see that with that as a start, where we can reach in the future. But with that, I would like to hand over to Alex.
Thank you. Can everyone hear me okay? Is that better? Okay. Great. So I'm Alex Dunlop. I work at the Royal Marsden Hospital in the UK. And this talk is, or these slides are largely adapted, excuse the pun, from a talk I gave at the recent BIR meeting in the UK, where the title was Online Adaptive Radiotherapy on 2 Treatment Platforms in 1 Centre. So we have had a MR Linac treating patients since 2018, a Unity system, and we really value our Unity system, and this is just an outline of the program of work that we have implemented on our MR Linac, where we started with relatively simple prostate adaptive treatments when we started in 2018. But in terms of the prostate indication, we've sort of moved from that relatively simple starting point to where we are now, where we're treating patients in ultra-hypofractionated regimes with focal FUS, and we treat a whole host of other indications as well. So over the 7 years or so that we've been treating on the MR Linac, some advances in the technology, such as the comprehensive motion management, which allows us to track the target and gate the treatment if the target moves outside a window, has really enabled us to enhance treatments for patients. So we really believe in adaptive radiotherapy on our MR Linac, but there are problems. MR Linacs are not particularly widely available, they're expensive. We don't foresee the short or medium or probably long-term future of replacing all of our 8 clinical machines with MR Linacs. But we do want to improve access for online adaptive radiotherapy for our patients. There are other limitations with MR Linacs as well. They tend to have limited field size available for treatments, and there are some treatment indications, especially around the pelvis, where nodes are included that just won't fit on MR Linac machines. So we wanted to work towards an online adaptive solution for our CT-based platforms, and obviously Ethos is already established in the market. But we don't have an Ethos, but we do have a RadExact, and we wanted to see if we could combine Raystation with our RadExact platform to see if we could implement fast, efficient online workflows of the sort of same timescale that centres with Ethos are able to achieve. I'm not very good at pushing this button. Okay, there we go. There are reasons why the RadExact is a good platform for this. It's got good quality imaging with long fields. I mean, the imaging is good enough for dose calculation. It's appropriate for contouring. So we see this as an ideal CT-based machine for online adaptive radiotherapy. Okay. So the four major players of online adaptive radiotherapy in the market at the minute are sort of all-in-one systems, and this is good because it provides seamless integration between the hardware and software, but of course you're limited to work within the frameworks provided by those companies. So our idea was to combine our RadExact with an independent state-of-the-art TPS with the tools capable of performing online adaptive radiotherapy for our patients. And then the idea is that if we can solve this problem for our RadExact unit, perhaps we could transfer it to other units in the future. Okay, so I'll just go through a few slides. So first of all, these are some of the lessons that we learned on the MR-Linac and how we applied them to online adaptive radiotherapy for the RadExact. So on the MR-Linac, we have a workflow diagram which shows the roles and responsibilities of what people, what their actions are in the online setting. So that works very nicely on the MR-Linac. So we updated that for our RadExact workflow so that everyone is confident of the steps that they're taking part in during the online treatment session. And then in terms of the online contouring, on the MR-Linac, we essentially it can propagate our ROIs from the reference image, either rigidly or deformably. But using the Raystation solution, there's more options. We can use the deep learning segmentation available within the TPS as well, which is a really big step forwards. In terms of dose calculation on our MR-Linac, we're sort of limited in the Unity framework to perform dose calculations with density overrides applied to regions of interest. Whereas the online adaptive radiotherapy workflows available with Raysearch have more options. So of course we can still use density overrides. With the RadExact, we could actually define a lookup table to perform dose calculations, but there are actually some really interesting tools within the software as well. We've decided to go clinically with the corrected cone beam CT approach, which is working really nicely for our patients in terms of dose calculation accuracy. Okay, in terms of online plan QA or plan checking, we take this very seriously for online adaptive radiotherapy at the Royal Marsden. In the MR-Linac framework, we developed our own C++ tool to check the plan complies with all the parameters we were expecting. For our Raystation RadExact solution, we could actually replace this with a Raystation script which checks the plan parameters instead. So it's sort of more integrated with the workflow. Okay, so if we're performing online adaptive radiotherapy with our RadExact Raystation solution, we need a reference plan generated in Raystation. We have a configuration file per patient, but that's sort of more technical details, and we have our handover log for the patient, so that every member of staff performing the online workflow is aware of all the pertinent clinical information for that patient. One set of staff treating from one day to the next may be entirely different, so it's important that they've got all appropriate information available. Okay, so let's go through our workflow in the online setting. So there's going to be lots of buzzing clicks here, isn't it? Okay, so first of all, we start by acquiring our daily image. But whilst we're doing that, we actually run a Raystation script, which we call a pre-flight check. And this checks that we're actually, we selected the correct patient and prescription that we're expecting for the day's treatment. After we've acquired the image, the script, the Raysearch script, will then automatically import the data into the treatment planning software, and then we can run our online structured templates, which can generate ROIs either using the deep learning segmentation, and we do that for most of our organs at risk, and we can either deform or rigidly propagate our target volumes across to the daily image, and then somebody who's authorized to edit them will make those edits. Once we're happy with the contours, we move over to the treatment planning stage. And this is really nice in the Raysearch software. It's basically a one button. So you push start and you can assign an online adaptive plan generation protocol in the Raysearch terminology. But essentially, once you've pushed play, it will optimize according to an objective function that you set in that protocol. Whilst it's optimizing, you'll also be able to see the original or reference plan dose calculated on the daily image set, so much like the ETHOS workflow. So that within a couple of minutes, you'll have a scheduled plan, or evaluated plan as it's called at the minute in the software, but I think that's changing, and also your daily plan. So you can appraise those two plans and decide which one to treat on the day. And then once we've got our daily plan, we can run another Raysearch script to check that plan. And we basically borrowed lots of the code from our offline RADXact planning workflows to check that the plan's safe. But we've also added a few more tests in the script that are appropriate for online adaptive radiotherapy. So certain plan parameter comparisons with the online plan compared to its reference plan, for example. Then our radiographers will perform verification image, so a second image of the treatment session, and perform a couch shift. And whilst that's happening, we also run another Raysearch script, which is a data transfer check. So this is checking that the plan delivered to the treatment delivery system is the same as the plan in the TVS. And then we can make a call out to the radiographers about the plan delivery time so that everyone's confident that we're treating the correct plan of the day. And then we go ahead and deliver our treatment. And so far, well, actually, let's carry on. After treatment at the moment, we've got some post-treatment tasks that are probably going to be dropped at some point, but as we just start this journey, we're probably testing a few more things than maybe we need to in the long term. But yeah, so we started this workflow clinically in March 2025. And that was for the post-op endo patient population. So they're patients that are currently treated with very large PCV margins because things can change quite a lot day to day. But even after a limited number of online workflow fractions that we've delivered, we're already in the process of analysing what margin reduction we can go to already. So there should hopefully be clinical benefit for the patients in the short term, which is really fantastic. And I think Raysearch and the Royal Marsden Hospital actually released a press release on Friday about this new workflow as well. So I'm very excited about that, and that meant I could speak about it here. Okay, next slide. Okay, and then I think this is probably the penultimate slide. So in our department, so this is a sort of floor plan of our department, we've got our Unity MR-Linac. We love our MR-Linac. It's an amazing platform. But we sort of feel it should be used to treat patients where using protocols where there's a specific benefit from the MR guidance. But we have now got a solution to perform online adaptive radiotherapy on our RADXact machine. So we've only got one RADXact machine at the moment, but we've got another one being shipped in the next 6 weeks. So we're going to apply this solution to that one immediately as soon as we get that. And then eventually, we're hoping that all of the code that we've developed within Raysearch and also using the tools within Raysearch for the automated replanning, we can apply these techniques to all of our other C-arm Linacs as well, so that we'll effectively be able to perform online adaptive radiotherapy on our entire suite of treatment units. So this was what I showed at the beginning, our sort of adaptive radiotherapy sort of program of work, as it were, since we started treating in 2018 on the MR-Linac. But we see that we really want to keep those MR Linac-based specific protocols on the MR Linac because we think it's doing a fantastic job, but we can start a new sort of pathway for adaptive treatments on our CT-based platforms as well. So finally, we've been performing adaptive radiotherapy in our clinic for a long time. We're very happy with how it is, but we wanted to widen access. And the solution that we've generated in Raystation on the RadXact platform, and we work very closely with Anna and the team at Raysearch to be able to achieve this. And we're very happy with the results. So we're really excited about where we go in the future as well. I think that's it. Thank you.
Okay, so thank you, both of you, Alex, Anna. So here you go. So that was the celebration I mentioned, the press release, official press release that now your established workflow is in clinical use. And it was a lot of information, useful information. Do we have any questions from the audience that you would like to have more insights? All right, do you?
Does it optimize on background dose, accumulated background dose?
We don't use any of that functionality. So when we do our daily plan, we're trying to generate a good plan on the daily image.
Thank you. So that was the first question to break the ice. Do you have a second question? That is fine. I hope you enjoyed the talk. The last thing that I can say from the point of Raysearch is that you see it evidently that what we want to offer everyone is no limits. We don't want to put any limits when it comes to adaptive workflow. So that's why Anna showed the continuum. So you can adapt in seconds, minutes, hours, or weeks. The choice is yours. And we want to provide these tools that would support that. So no matter what machine you have, no matter what system you have in a clinic, we're there together with you to figure out how to finally implement adaptive workflows in a clinical work life. So yes, thank you so much. And yeah, big applause to the presenters.